Today, we are talking about something I am incredibly passionate about and honestly, something I wish more of us had been taught much earlier in life. If you are a female athlete or raising one, this episode is for you because we are seeing a pattern in our young female athletes. More ACL injuries, more hip and knee pain, and more girls being told to just rest their injuries instead of actually being taught how to move well and reduce injury risk in the first place. This episode comes at a perfect time as we are rounding up spring sports seasons and going into summer. And I think of summer as this beautiful time for preventative care where we can rebuild the foundations of hip and knee strength, landing mechanics, and understanding our bodies as female athletes so that you can enter your competitive sports seasons with a greater edge. So the truth is that so much of injuries that we are seeing today are preventable with the right education early on. As a pelvic health and orthopedic physical therapist, I am seeing more and more young female athletes coming into the clinic with injuries that didn't have to happen. ACL tears, chronic knee pain, hip instability, and even early signs of pelvic floor dysfunction like leaking during sport. Now, I want to stop right here and say that there is zero guilt and shame around this because I myself dealt with many of these issues. So while I'm talking about preventative care from the angle of I ideally like to address these things before we even start to notice them, that is most often not the case. So do not, quote, feel bad if you're like, well, I'm experiencing some pelvic floor symptoms, or I tore my ACL, or I have an MCL sprain. Like, it's okay. These things happen, and not all injuries can be prevented. I also want to say that because we have acute injuries in sport. Yes, they happen. Yes, you can land and somebody jams into your knee at the same time. So there are certain elements of injury in sport that we just can't prevent and that are just going to be part of it. But what we can prevent are more of those overuse injuries and non-contact sport injuries. So these are those types of ACL tears that occur when somebody comes down from getting a rebound and there's nobody else around them and they tear their ACL. How does this happen? Well, we're going to dive into all of that today because with female athletes, our hormones are different throughout the month compared to our male counterparts. We also have different hip to knee angles than our male counterparts that puts us at an increased risk of injury. But there are things that we can do from a prehab standpoint, if you will, so preventative rehabilitation, to help improve your landing mechanics so that you are at a reduced risk of injury and non-contact injuries, okay? So what we're going to discuss today and what I am really excited to be diving into in a 4-week female athlete series this summer is how to land correctly when you're jumping or running, how to decelerate with the appropriate muscle control, how to use your core and your pelvic floor together in a coordinated manner, and even how your cycle impacts your body throughout different times of the month. Theology of your body, if you will. So let's cut to the chase. Female athletes are different. This is where we need to shift the conversation in high school sports. Female athletes are not just smaller versions of male athletes. We have a wider pelvis. This changes our hip and knee alignment. Why do we have a wider pelvis? Think of the need for childbirth later on in our life, right? So it's a biomechanical advantage to us as females with what we're asked to do in our fertile years later in life. But we start to see these changes in adolescence where that pelvis widens and we look at this hip to knee angle and it's greater in females than males for this reason. We have different neuromuscular control patterns, like how our pelvic floor fires before our core, and more importantly, hormonal fluctuations that impact tissue integrity throughout the month. And this changes throughout our cycle and is going to be different for every female athlete on the team because we may move through our cycle at different times, or you may not even have a cycle. So that's an important part of the conversation as well. There are specific times during a female's hormone cycle where ligament laxity increases, meaning the joints are a bit more vulnerable. So this is important information to have as a female athlete to just know. It doesn't mean that we stop training, but it does mean that we start training smarter. So let's talk specifically about ACL injuries. Female athletes are up to 2 to 8 times more likely to experience an ACL tear compared to males in similar sports. Why? Well, this is multifactorial. Number one is this increased knee valgus angle during landing. So this is whenever your knees angle in towards each other whenever you land. Again, biomechanically, we're set up for this more than our males because of that wider hip to knee angle. So we need to teach female athletes early on, and male, how to land with our knees pointing forward. And I like to think of like headlights on your knees so that when you land, both headlights are shining straight forward. If those headlights are angling in towards each other, that means we have a degree of knee valgus, which increases ACL tear or knee injury risk. Poor hip and glute strength and control. So whenever I am performing an evaluation on my high school athletes, on collegiate athletes and professional athletes that I've treated, I am always testing strength. And it is amazing how we can find weakness in these elite athletes in our deep hip rotators and our hip abductors. So these are very important stability muscles that often get overlooked. They're not our prime movers, specifically in sports like running. When you run, you're running in a straight line. So our forward and back muscles are often super strong, your hip flexors, your hamstrings, your quads, your glutes. But when we look at our side glute muscles, your gluteus medius and minimus, and your deep hip rotators, like your obturator internus and externus and your piriformis, we oftentimes find weakness. And these muscles are so important for controlling that knee stability when we land. Something I will also see in the office are delayed muscle firing patterns. And so this is when I'm looking at the coordination of how these muscles fire. So ideally, whenever we jump, for instance, and then we land, we want good ground reaction forces all the way up. So we want the foot to start taking on that impact. We want a nice soft knee bend. We want that pelvic floor to give. We want it to act like a hammock or a trampoline, if you will, where it descends on that landing. And then as we rebound up on an exhale, we get that lift or that recoil of the pelvic floor muscles. And then the deep core muscles turn on. What we'll sometimes see in the office is like a breath holding pattern where that core is overly engaged and thus the pelvic floor can't coordinate with it appropriately. Or we have really stiff landing mechanics. So the ankle, the knee, and the hip aren't helping absorb the force and it's just all being jammed up into that low back or that SI joint, which may present as hip pain or tailbone pain or even pelvic floor symptoms. Then one of the biggest contributors I see is that no one taught them to land. So as I'm talking about taking on these muscle firing patterns and coordinating it appropriately, as in any sport, we're having to land, right? If we're running, we're doing a series of single leg hops when we run. If we're playing basketball, we're having to jump up and then land and accept that force. So we need to train these muscle firing patterns like on the mat with cross training specific and strength training activities. But then we need to take it sports specific with landing mechanics so that agility, and when you're actually in the playing field, you are applying what you've learned in the cross training parameters, such as what we might do in a clinic setting together. You're able to apply it to your sport directly. And then yes, the last of the multifactorial approach as to why females are more susceptible to ACL injury tears at a 2 to 8 increased risk would be these hormonal influences affecting ligament stability throughout their monthly cycles. So what should early intervention look like in our female athletes? Imagine if our middle school and our high school girls were taught how to land with proper alignment, how to absorb force through the ankles, knees, and hips instead of just a nice, strong landing. If they were taught how to coordinate their breath with movement, and how to engage their pelvic floor and core reflexively. So this isn't about making things overcomplicated. It's about giving them the right foundations for health now so that we can set them up for success later. And what I will say with this is it comes in the form of a lot of cross training. So when I am seeing patients in the office, I am giving them home exercises that I ask them to do 3 to 4 times per week. This is meant to complement what you're doing on your high school sports team already. So for instance, if you're a runner, your cross training days are going to include about 15 to 20 minutes of stability and strengthening exercises. We're oftentimes getting barefoot so that we can get those teeny foot stabilizing muscles to work outside of your shoe, so that then when you are in your spike, your cleat, which has less stability than the shoe that you are training in, the road running shoe, right? That your foot is able to take on dynamic impact and better support that entire kinetic chain from your ankle, through your knee, through your hip, through your back, okay? We are working on all those little stabilizing muscles that I mentioned earlier oftentimes have weakness. And then we are looking specifically at your breath. If you've listened to this podcast before, you know that I love, love, love talking about diaphragmatic breathing. The reason this is so important in our high school athletes is because this is the time in adolescence and into high school that we oftentimes see the breath starting to get caught more up in the chest. If we look at little babies, little toddlers, they're breathing into their belly. It's how we are biologically designed. But as we move through life and more stressors are thrown our way, we kind of forget how to breathe properly. And our typical breathing pattern transitions to more this fight or flight mode where we're breathing into our upper chest. When we do that, you're not tapping into your diaphragm. Your diaphragm lives directly underneath your lungs, and we need that diaphragm to drop on the inhale. When it does, it activates your vagus nerve, which links up to your parasympathetic rest and digest portion of your nervous system. What it also does is pushes all those internal abdominal contents down into your pelvic floor. And that pelvic floor should again act like a trampoline and descend to help with this pressure management throughout that core canister. And this truly is imperative for every athlete to learn, especially our female athletes. What we do then is we take that to function. So we look at how can we utilize that breath with core training exercises, with landing mechanic exercises, so that we can put all of the pieces to the puzzle together. So I want to talk for a minute on this podcast and in this safe space about the pelvic floor component of all of this, because this is not something that our high school coaches are addressing, right? Nor should they necessarily be. They're not trained to, right? And it's a part of the body that just has so much nuance around it. It's a group of muscles, just like our quadriceps muscle, but it's in an area of the body that is much more sacred and private. And so that is where I, as an orthopedic and pelvic floor physical therapist, get to bring this piece of the puzzle into play in a very age-appropriate, safe manner, but looking at it as a part of your body and as a part of a whole that impacts the way that you're able to perform your athletic abilities. So we can't leave out the pelvic floor piece. It really is that connection between our lower body and our upper body, right? And our core canister. So it's that transition point, and a lot of athletes who are experiencing hip injuries, knee injuries, low back pain, if the pelvic floor isn't a piece of the puzzle that's being addressed and you're getting recurrent injuries, this would certainly be something I would reach out about, and to see a provider such as myself and my team who can help you work through this. So, young athletes can experience leakage, and no, it is not normal to do so. Now, when I'm saying leakage, I have seen young athletes who are experiencing urinary leakage, even bowel leakage, and oftentimes this can come from an overly active or an overly tight pelvic floor. Now, pelvic floor dysfunction does not always show up as leakage. It can show up as hip pain, as back pain, as knee pain, ankle pain. Really, we can see it show up anywhere in the body. So that's why I mentioned if you're getting recurrent injuries and you haven't had the pelvic floor piece of the puzzle addressed, then this would be something to consider. Now, myself, when I was a young female athlete, I struggled with urinary leakage. And so I mentioned that as this is a safe space, it's something that I myself dealt with before even having children. And so I want you to know that you're not alone. Your child is not alone if they're experiencing this with athletic activity. It simply is your body's symptom showing that there is dysfunction somewhere in how these muscles are firing. Again, sometimes that symptom is leakage, sometimes it's pain. And the reason or the root cause could be something similar, such as pelvic floor tightness. Since we look at the body as a whole, we're looking at, again, the hip strength. Oftentimes, we can see pelvic floor tightness because there's a weakness in some of the hip muscles. And so we're addressing that at the same time. So we're not zeroing in only on the pelvic floor. We're looking at this as just a piece of the puzzle. Now, I do want to mention here, with pelvic floor physical therapy, I think it's this like nuance. It's like, what do they do in there? Like, what is it? We address everything with our athletes externally. Like there is no internal work for the pelvic floor. So you do not need to worry about that or have this fear of coming in. We address everything externally. And so what that could look like is getting to some tight pelvic floor muscles through dry needling. We could get in through the glutes and through those deep hip muscles by angling in the needle appropriately. We use a 3-inch needle so it gets deep beneath the surface and can get change in those deeper pelvic floor muscles without having to go to the pelvic floor itself. We also can address these muscles through our breathing mechanics. So from more of that inside out approach, with the diaphragm and that core canister movement as mentioned. We're also talking about nutrition and hydration, because when we're chronically dehydrated, we can see some of these symptoms pop up. If you're not consuming electrolytes, then our water's not getting where it needs to go in our system. So that can also bring up some of these pelvic floor related symptoms. And so I mention this as if you're a mom or if you're a high school athlete and you're listening to this and you're like, I'm scared, like I'm nervous. It just makes me nervous to talk about that area of my body, to know that we can go about it in a way that feels very comfortable for you. And we will make sure that you understand that your pelvic floor is part of your core system. When we talk about the core, the pelvic floor is an important component of that. And so a female athlete needs to understand pressure management, how to brace and breathe through it and not breath hold, how to coordinate their breath with movement, both with landing impact and with a repetitive motion such as running. And then to understand core and pelvic floor synergy. The reason this is so important is that the core cannot fully fire without the pelvic floor. So we hear so much about core strength in cross training and for female athletes. And I myself remember when I was training, we would do core strengthening exercises as part of our cool down routine. If you're not tapping into the pelvic floor, your core will never be able to fire at full strength. So again, a piece of the puzzle that cannot be ignored. And if these areas are ignored, the pressure management, the breath coordination, and the pelvic floor and core synergy, then the body will compensate somewhere. This is where injuries start to show up. So we need to look at the bigger picture and understand that this is so much more than solely preventing one injury in our female athletes. This is about longevity in sport, confidence in their body, and preventing issues that carry into pregnancy and postpartum later in life. This is something that I now have the gift of perspective in, and that I gratefully was able to address my own symptoms in college well before I moved into the preconception and the pregnancy seasons of life. But what if we started sooner? What if we gave our junior high and high school athletes the understanding in their bodies now to A, set them up for better success and better performance in their sport at the present moment, B, reduce their injury risk at present, and C, to set them up for greater longevity within that sport. And then D, fourth and final, would be long-term health outcomes, right? Helping them reduce injury risk or pain and discomfort during pregnancy and postpartum seasons of life later on. So in closing, if you are a parent, a coach, or an athlete listening to this, start asking questions and start understanding that there is help for you. We're not just training for performance, we're training for resilient, well-functioning bodies in the long term. And if this is something that you want support with, whether for yourself, your daughter, or your team, this is exactly the lens that we practice inside my Holistically Well Physical Therapy, orthopedic, and pelvic health private practice. Myself and each of our providers are trained in orthopedics and sports medicine physical therapy, as well as pelvic floor physical therapy, so that we can address your female athlete as a whole and not in bits and parts. This is also why I'm offering a female athlete series this summer in conjunction with a local Pilates studio. So by the time this airs, all spots are probably filled, but reach out if you're interested. And if spots are all filled, we definitely can do this again. So I can bring it in a virtual format to your team or in an in-person format if you're local to the Sydney, Ohio area. And if you would benefit from one-on-one support, my team and I would be happy to help. Simply visit drkaylaborchers.com and you can schedule a visit right away or hit the contact button and reach out with any questions that you have for me and my team. Again, until next time, take care and be well.